right. Are you able to see my slides now? Perfect. All right. Like Jennifer said in the introduction, I'm going to be talking a little bit about my current research study, which is looking at acceptance and commitment therapy for the family and friends, or as we say in kind of the research world, the informal caregivers of long-term care residents. I just have to acknowledge when I do a presentation on this that my work is funded by the Social Sciences and Research and Humanities Research Council of Canada. So begin with just a brief introduction of myself before talking about the roles, experiences, and feelings that informal caregivers often experience, what we typically do for supporting those kinds of feelings, acceptance and commitment therapy, how that can be used to support caregivers, the purpose of my current study, how you can participate, and then there are other ways that you can get involved in research on this topic. So, just to begin with a little bit more about myself, I am a PhD student in clinical psychology at the University of Regina. Within the University of Regina, I work out of the lab called the Aging Residents and Caregivers Research Lab, which is led by Dr. Natasha Gallant, a registered doctoral psychologist. Um, I will note if you look us up right now, our website is a little bit dated. That's just because we're going through a bit of a transition, moving into a new physical lab space, and my supervisor, Dr. Glenn, is also preparing to go on mat leave shortly. So things are a little jumbled right now, but typically, if you look us up online, you can find some research to participate and a little bit more about the work that we do. So, to get into the main topics here today, we're talking about informal caregivers, so those family and friends of long-term care residents specifically, though much of the information I share can be applied to caregivers more broadly. As I'm sure many of you guys are aware, right now in Canada, the older adult population is growing very, very quickly. And so as a result, we're seeing more people needing care, and the care that people are needing is often more complex, more intensive, and longer lasting than we've ever seen before. Within this context, the roles of caregivers are evolving with the aging population. So now, even when someone moves into long-term care, family members and loved ones don't necessarily stop being caregivers to their loved ones. Instead, their roles as caregivers just shift alongside the changing needs of their loved one. So here we refer to these individuals as informal caregivers, and they really do play a strong, crucial role in supporting residents. They do this because they typically bring something that no formal caregiver can fully replace. So they have that deeper knowledge of the resident's history, the resident's preferences, their life story, and kind of they know what matters most to the resident. They also can provide a range of practical or what we call instrumental supports. So those are things like helping with grooming, managing the resident's finances, or coordinating transportation to and from outside appointments. Just as importantly, these informal caregivers often provide emotional support. So they may have to take on the role of an advocate within long-term care. They may have to maintain social connection with family and friends. And even simple but really meaningful things like just physical touch and presence within the care home can go a long ways in terms of emotional support. So even within that more formal long-term care settings where nurses take on some of the physical load, caregivers still remain an essential part of the care team. Now, caregiving, as I'm sure you are all aware of as well, can be a really complex experience. And it's one of the most important things that we kind of recognize that it's not an experience that's necessarily all negative or all positive. It's kind of both at the same time for a lot of people. So, on one hand, many caregivers report feelings of joy and satisfaction in fulfilling these caregiving tasks for their loved ones. There can be a really strong sense of meaning and purpose and connection that comes from supporting someone that you care about. However, at the same time, caregiving can come with many significant challenges. So many individuals experience what we call caregiver burden, which is feelings of being overwhelmed, emotionally drained, or stretched too thin by the demands of the role of caregiving and all the roles you maintain outside of being a caregiver. Alongside this, it's also common to see increased symptoms of depression, such as like a low mood, a loss of interest, or symptoms of anxiety, such as feeling constantly worried or feeling on edge with caregiving. So, overall, caregiving can be both deeply rewarding but also highly stressful, and it's important that we acknowledge and can support all sides of this experience. So, for that reason, the study that I'm going to get into a little bit later here is going to be looking at caregiver burden, depression, and anxiety symptoms. To define those terms a little bit more, caregiver burden just refers to the physical, emotional, and mental strain that can come from caring for someone over a long time. So, for a lot of people, caregiver burden looks like feeling really tired or burnt out, noticing more stress or anxiety, or really just feeling like there's never enough time for yourself. Some people also notice changes in their sleep, their mood, or even within their relationships. A big reason that these feelings happen is because caregivers don't often get a lot of breaks. You're balancing appointments, other responsibilities, complicated emotions, all while still trying to manage your own life. And what I really want to emphasize here is that if any of these feelings feel familiar, you're not alone. It doesn't mean that you're doing anything wrong as a caregiver. It doesn't mean that you're neglecting your own health or needs as a caregiver. It really just is the result of the multifaceted role of caregiving, where there's a lot going on pretty consistently. These reactions are very, very common, and they're a big part of why research like mine and the research that I look to as kind of inspiration exists. When caregiver burden becomes high and sustained over time, it can start to have real negative impacts on a person's health and well-being. So, for many caregivers, this can mean a decline in their overall quality of life, feeling more fatigued, having less time for themselves, and experiencing poor physical and emotional health. We also see that high levels of burden are linked to a greater risk of hospitalization, as many caregivers don't have the time to focus on their own health needs while also supporting the person that they are caring for. Additionally, caregiver burden has been found to be strongly associated with other mental health outcomes, such as increased symptoms of depression or anxiety. Now, when I use the terms depression and anxiety, I'm talking about some of these common signs that caregivers often experience. So, as a caregiver, you might notice things like feeling constantly worried or on edge, anticipating something bad is going to happen, having trouble sleeping or relaxing, or feeling overwhelmed or irritable. Some people also describe having low energy, increased feelings of fatigue, or just lost an interest in doing things they used to enjoy, such as crafting, reading, going for walks. Suddenly, those activities just bring you less joy, or you're less interested in doing them. Other people tend to feel sad, emotionally numb, or just kind of checked out, and they can struggle to concentrate or stay focused and make decisions in day-to-day life. It's also really common for caregivers to experience guilt, so feeling like you're not doing enough, even when you're already giving so much to kind of all of your roles. Again, what's important to highlight here is that all of these reactions and these feelings are very common and understandable responses to the demanding and emotional role of a caregiver. And so it's important that we can recognize that these signals or that these signs might be signaling that you need additional support, which is why research such as mine and other interventions that I'll speak a little more to do exist and that you kind of are aware of how to access them. Now, in terms of what's typically done for people who, or caregivers really, who are experiencing symptoms of burden, depression, or anxiety, what we typically see is therapists offering cognitive behavioral therapy. So, cognitive behavioral therapy, also the acronym for CBT, is kind of considered the gold standard of therapy for feelings of burden, depression, and anxiety. It's one of the most widely used approaches for tackling these types of emotions and these types of problems. And it focuses on the idea that our thoughts, our feelings, and our behaviors are all interconnected. So If you go to a therapist and they are going to do CBT with you, what typically happens is you're taught how to notice unhelpful thinking patterns. So you may have the thought, if something goes wrong, that means it's all my fault. And then you and the therapist would work to challenge or reframe those thoughts so that they're less distressing and more accurate of the whole picture. For example, the thought, if something goes wrong, that means it's all my fault, can often bring up a lot of feelings of guilt, shame, and anxiety. And in response, caregivers might feel like they have to do everything themselves or do more of it, check on things more, not take any more breaks, and avoid asking for help because they think they need to do it all alone. In doing that, we find people kind of enter that cycle where then they're back to, well, I'm doing everything. If something goes wrong, it's all my fault. And you kind of get stuck going around in this cycle. So that's where the therapist works with you to break through that cycle in challenging that thought to see, is it entirely accurate of the picture, or is there a different way to look at things? Now, while CBT can be very helpful for a lot of people, including caregivers, sometimes CBT can be a bit challenging for caregivers. Often because some of the thoughts and feelings that caregivers experience can be difficult to challenge because they can be tied to real and really difficult situations like changes in your loved one's health. In those cases, it's not always helpful or realistic to try to change or challenge those thoughts or perspectives. So, for example, thoughts like, my loved one's condition is progressing and getting worse, or this is something I can't fix, may be at least partially or completely true. Even though these thoughts can be painful, they can also be realistic. So if we take time to try to challenge or reframe those thoughts, it can sometimes feel almost invalidating, like we're minimizing or ignoring what's actually happening. So that's where other approaches, such as acceptance-based strategies that I'm going to be talking about, can be really helpful. Because instead of trying to change the thought, they focus on how we relate to our thoughts and cope with them. So the study that I'm conducting is looking specifically into something called acceptance and commitment therapy, or ACT. So as a caregiver, you often experience feelings like guilt, stress, worry, low mood. And ACT recognizes that these feelings are normal. They may be normal to the context as well, but ACT doesn't try to eliminate these feelings or these thoughts. It just helps you to respond to them in a way where it doesn't take over your life. So, to get into more details about what acceptance and commitment therapy is more broadly, acceptance and commitment therapy is another evidence-based approach. It actually came out of cognitive behavioral therapy. So, there's lots of research on acceptance and commitment therapy on other populations. I will say, kind of family and friends of long-term care residents and caregivers as a whole tend to be overlooked in research. So, there's not a ton of research on ACT and caregiving, hence why we're looking at it now. But essentially, up to this point, it is an evidence-based approach that focuses on developing something called psychological flexibility, which is just a fancy way of saying that you have the ability to stay focused on the present moment, that you're able to openly experience your thoughts and emotions, even when they're difficult, and that you're also able to act in ways that are guided by your own personal values. So again, rather than focusing on changing or getting rid of thoughts like cognitive behavioral therapy typically does, ACT focuses on how we relate to these thoughts when they pop up into our heads. It's not about fixing the thoughts. It's not about necessarily always feeling better, always having positive thoughts. Instead, it's about building a meaningful life, even when experiences are difficult, emotions are difficult, and our thoughts are difficult. So, ACT kind of recognizes that some of these thoughts and emotions, especially in caregiving, are completely natural and they're not just going to go away. The key message throughout ACT is that you can have these difficult thoughts and feelings popping up, but at the same time continue to live a life that feels meaningful and aligned with what matters most to you. So on this next slide, I have a diagram that I took from contextual consulting here. and it represents the six core processes that go into making what we call psychological flexibility. At the broad level, and I'll go into these processes in more detail, but at the broad level, these processes work together to help people stay connected to the present moment, make room for difficult thoughts and feelings, and take actions that are guided by what matters most to them. So, again, we're not trying to get rid of distressing thoughts here. We're just trying to be able to live alongside them in a more workable way. So, in terms of our values here, values are what matters most to you as an individual. They're your guiding principles, or they're kind of the kind of person you want to be, the kind of life you want to live. For many caregivers, values can include things like compassion, connection, being a supportive family member, showing up for people you love, things like that. Now, values aren't necessarily goals that you can just check off a list. They're just ongoing directions that you want to take in your life. So, for example, you don't complete the task of being a caring person to your family members. You just keep choosing actions every day that reflect that value. In caregiving, values can be especially important because they can help guide your decisions, even in really, really difficult situations. So, when things feel overwhelming or uncertain, coming back to what matters most to you can provide a sense of direction and purpose. So, in ACT, we focus on helping people identify their values and use them as a guide for how to show up to things, even when they're facing real challenges. Attention to the present moment refers to bringing your attention to what is happening right here, right now, in the moment, rather than getting pulled into worries about the past or the future. So, for many caregivers and people more broadly, it's really easy to get caught up in what if thoughts, like worrying about how things might progress or replaying moments that were distressing that have already happened. And while those thoughts are completely understandable, they can also take away from what's happening right in front of you. Being present is about gently bringing your attention back. So, whether that's to a conversation you're having, a small moment or connection, or even just noticing things like your own breath or your own surroundings. Now, it doesn't mean that we're ignoring concerns about the future or just pretending things aren't difficult. It's simply about learning how to anchor yourself to the present moment so you're not being constantly pulled away by those distracting or distressing thoughts that pop up. In ACT, focusing or learning to rather pay attention to the present moment can help to create a little bit more space and awareness so you can respond more intentionally rather than feeling like you're kind of stuck on autopilot or you're stuck worrying and ruminating about your own thoughts. Acceptance is, of course, a major piece to this form of therapy, and it refers to allowing your thoughts and feelings to be present rather than struggling against them or trying to push them away and avoid them. So, for many caregivers, difficult emotions such as sadness, worry, frustration, or even guilt are a natural part of the experience. And it's very common to feel like you shouldn't be pushing those or like you should be pushing those feelings away. You shouldn't be feeling that way because those are emotions we tend to not enjoy experiencing. However, rather than trying to avoid those feelings or trying to push those feelings away, acceptance takes a different approach. It allows us to make space for them. So it teaches us to acknowledge when these thoughts pop up, that they're there, without needing to get rid of them. So, for example, you may notice that you're feeling sad about a loved one's changing health status. And instead of trying to suppress that feeling, trying to allow it to be there while still continuing about your day and still living in that present moment. Sometimes people struggle with the concept of acceptance because they think that kind of means that we are giving up or we're giving in or we're choosing to like the situation. We're not trying to we're not trying to have people change their opinion of the situation to say that we're okay with it, that we like it. But what we're trying to do is just recognize that there are some thoughts and emotions that are part of being a human being, and sometimes those thoughts and emotions aren't pleasant. So we need to learn ways to carry them in ways that are a little bit more manageable and don't disrupt our engagement in other aspects of life. So in ACT, This can reduce the constant struggle with internal experiences and free up our energy to focus on what matters most. So, whether that's visiting with family, getting outside because it's a nice day, things like that. Another component is diffusion, also called cognitive diffusion at times. All diffusion is creating distance from your thoughts, so you see them as thoughts rather than something that's absolutely true or facts. So you may have heard the term that your thoughts are not facts. That's a big part of this as well. So for many caregivers, thoughts can feel really, really convincing and really powerful, especially thoughts like, I'm failing as a caregiver, I should be doing more. It's really easy to get kind of pulled into those thoughts and treat them as if they're completely true facts, because often they come on really, really strong. So diffusion, or cognitive diffusion as it's called as well, offers just a different way of responding when those thoughts popped up. So instead of getting caught up in the thought, paying attention to it, building on it, you learn to take a step back, notice it, and label it. So people will kind of learn to say, oh, I'm having the thought that I'm failing rather than I'm failing. In creating this small shift and that kind of bit of space between ourselves and the thoughts, the thought then has less control over how you feel and what you do. So again, the goal isn't to get rid of the thought, but just to change your relationship with it. So it doesn't just automatically pop up and dictate your actions. In ACT, this can help caregivers to feel less overwhelmed by difficult thoughts and be more able to choose how you want to respond, even when those thoughts inevitably show up. The next piece is self as context. So, this is the idea that you are more than your thoughts, feelings, or your caregiver role, or any role that you take on. You're just noticing, or you are the one that's noticing and experiencing all of these things. So, for many people, it's really easy to become fused to certain roles. So, it's really easy to feel like I am this person's caregiver, that's what I am, or that's all I am, or to define yourself by your difficult thoughts, such as, I'm not good enough. Using yourself as context invites a little bit more perspective in. So instead of being completely caught up in those experiences, you begin to notice that there's parts of you that's observing them again. So your thoughts, your emotions, and your roles can change over time, but that observing part of you remains a constant. So, for example, you might say, I'm feeling overwhelmed right now, rather than I'm overwhelmed. And again, that kind of subtle shift creates that space between you and your experience, which can be really helpful when we take on roles that can feel really all-consuming. It's a reminder that while the situation might be really important, it could be caregiving as an important part of your life, but it doesn't define your entire identity. So, in taking this perspective, people tend to feel less stuck in their thoughts and emotions and more grounded in just a stable sense of yourself. The last piece is committed action. So, this is about taking steps and actions that align with your values, even when it's difficult, even when uncomfortable thoughts or uncomfortable feelings are present. So, this might mean continuing to show up to your roles with care and compassion, even on days when you're feeling unsure of yourself or overwhelmed. Again, here, committed action doesn't mean that you're doing everything perfectly. It doesn't mean that you are pushing yourself to the point of burnout. It's just about making small, meaningful choices that reflect what matters most to you. So that could be things such as spending a few intentional moments connecting with your loved one, asking someone for help when you need it, or even taking care of your own well-being because you value your own health. The key idea here is that your actions are being guided by your values, not by trying to avoid feeling uncomfortable or waiting until you feel better or waiting for a situation to change. So in ACT, committed action helps you turn your values into something tangible. They're into real actions that you can take. So you're not only just identifying what matters to you, but you're actually living in a way that reflects it, even if you're in the middle of real challenges. So now I just want to talk a little bit more about the study that we're currently working on in our research lab. So as I described, acceptance and commitment therapy involves a lot of different pieces, and in practice, it can be offered in different ways. So, acceptance and commitment therapy can be offered in person by practitioners. It can be offered online. There's different kind of ways to do it. Sometimes it involves attending a group program over several weeks. For our study, we're taking a slightly different approach to ACT. So we are looking specifically at a single session acceptance and commitment therapy program. It's called the ACT Guide Lite. It was actually developed by a professor down at Utah State University. And this online self-guided act takes about only 45 minutes to complete. So it's done in a single session, entirely online, and it's self-guided. So the program, you input your ideas and it walks you through each step. So it walks you through picking your values, choosing committed actions, things like that, all without any in-person help from like a live person. So we chose this format because while traditional therapist-led programs and support groups can be really helpful in reducing caregiver stress and improving well-being, many caregivers face very real barriers to accessing them. So things like transportation, time constraints, cost, and even stigma can make it really difficult to attend regular sessions. And if we're not attending regular sessions, we're not getting those benefits. So self-guided online programs such as the ACT Guide Lite offer a more flexible and accessible option. And research has shown that using online acceptance and commitment therapy can significantly reduce feelings of anxiety and depression and can be really helpful, especially for people who are balancing many responsibilities or people who live more rurally and just don't have access to in-person supports. We also kind of chose this method because longer online programs often have really, really low completion rates. So again, while they might be easier to access because you can access them from home, they do require an ongoing time commitment, and we know that life can get hectic and people tend to kind of leave these programs and again, not benefit fully because they just don't have the time to complete them. So that's why single session interventions have been developed specifically for caregivers, just because they're very brief, they're very focused, they're easier to fit into a busy schedule, and they still can offer meaningful tools and help manage stress and difficult emotions. So essentially, to make our study as accessible and manageable as possible, we're going to be using the ACT Guide Lite. So the one-time 45-minute single session self-guided acceptance and commitment therapy intervention. Now, we have some initial findings on the success of this program. Another lab mate of mine, her name is Brianna DeRue. She's a master's level student in clinical psychology who is currently wrapping up her thesis work. And she conducted what we call a feasibility study on the ACT Guide Lite, so the exact same ACT as this study. The goal of the feasibility study is just to determine whether an intervention is actually practical, if it's acceptable to the population that we're offering it to, and if it's kind of worth studying further so that we can make more definitive conclusions about its effectiveness. So her study looked at 25 caregivers of long-term care residents from Saskatchewan specifically, and she had a 100% completion rate. So that means that every single one of her 25 people completed the entire intervention, which is really encouraging. It kind of tells us that caregivers are able to access and complete the session without any kind of major barriers popping up. She also asked participants about if they found it to be acceptable and satisfying, and they said that they reported a moderate level of satisfaction and largely positive feedback, indicating that the intervention was well received, and they also provided some helpful suggestions for improvement, which were then incorporated into my study's kind of ACT Guide Lite model. In terms of more preliminary outcome measures here, there were also statistically significant improvements over time in depression, anxiety, and burden. So all three of them went significantly down. And caregiver quality of life increased to a statistically significant impact as well. So when we say statistically significant here, it means that the increases or decreases were so large that they were unlikely to be due to chance and very likely to be due to the intervention. So overall, this preliminary study found that the intervention is feasible and acceptable, and it shows promise for improving well-being, supporting the need for further research. So now, what my study is doing is expanding on these findings by conducting a larger study. So we are looking at 178 different caregivers from across Canada. We're also using a randomized controlled trial design for this study. So this means that participants who choose to engage in the study are randomly assigned to either complete the ACT Guide Lite or they receive psychoeducation in that they are provided a web page with resources on managing caregiver stress. Randomized controlled trials are used because it allows us to directly compare the two groups and it helps us to determine whether the ACT Guide Lite truly does lead to greater reductions in caregiver burden, anxiety, and stress. So it kind of tells us with greater power that the Caregiver ACT Guide Lite is truly helpful. It's important to note too that participants who are randomly assigned to the psychoeducation group first will also be given the opportunity to complete the ACT Guide Lite once the study is finished. Um, yeah, so once the study is finished, everyone kind of gets the opportunity to engage in the program. So to walk you through exactly what participation looks like for this study, first you complete a really short eligibility form online. This just helps us to make sure the study is a good fit for you. After that, what typically happens is you schedule a really brief, like under 5 minute either phone call or Zoom meeting with myself or a research assistant. And this is just to reconfirm eligibility, give people the opportunity to ask us any questions they might have, and also confirm that we're not, because this is an online study, that we're not getting bots in to mess up with our results. Then, if you're determined to be eligible and you choose to continue to participate in the study, you complete a brief set of questionnaires about your mood, stress, and caregiving experiences. Then the survey software automatically randomly assigns you to either the ACT Guide Lite, which again takes 45 minutes, or the psychoeducation webpage, which again is about like a 15 to 45-minute read. After the session, so after you complete the intervention or the psychoeducation, you are asked to fill out questionnaires 2 weeks later and then 3 months later. So we send them to the link to you over email. These surveys take again less than 15 minutes to do. Everything in this study is done entirely online, and it's designed to be flexible so you can complete it at times that work best for you. We follow up at 2 weeks and 3 months just so we can see if the changes in depression, anxiety, and burden are maintained over time. Then, as a small thank you for your time, participants get the chance to be entered into a draw to win one of 10 $100 electronic gift cards. In terms of who is eligible to participate in the current study, we require that participants are at least 18 years of age, that they currently have a loved one living in long-term care. There's absolutely no requirements for how long they've lived in long-term care, your relationship to them, how much time you spend in long-term care, anything like that, just that you have a loved one that's living there. We ask that you're currently residing in Canada, you speak English because that is the language of the intervention, and that you endorse at least a moderate level of anxiety or depression. Now that happens automatically on the eligibility survey. It does the math for us to let us know. And then the last criteria is just that you're not currently receiving any psychological treatment. So we can again say that if we see some findings here that are significant, like feelings of anxiety go down, we can attribute them more easily to the intervention and make sure that it's actually what's helping here. So if you wish to get involved with the study I just described, I will have, like, this slide kind of has my contact information, a QR code that can be scanned, as well as the link to the survey that can get distributed. And that takes you right to the eligibility survey, and then I get in contact with you once you complete that to schedule that brief phone call. If this study doesn't seem like it's for you, please feel free to send any information to anyone you know who might benefit from it. And if you're looking to get involved in some other research, I just wanted to make note of a few organizations that have research opportunities. I'm going to speak to each of these a little bit more, but the first is the Center on Aging and Health at the University of Regina. It has a directory of potential research participants that you can get added to. There is also the Saskatchewan Centered for Patient-Oriented Research, which I'll speak to more as well. Essentially, it asks for people with lived experience and it invites you to contribute in research as either a participant or on a research team as part of the research team. There's also the Alzheimer's Society Research Portal, which connects participants to ongoing study opportunities. So, to speak to each of these a tiny bit more here, the Center on Aging and Health is based out of the University of Regina, so if you either follow that link or just search it up, search for information for potential participants, there are instructions for how you can get involved in research. Essentially, what happens is you get your name added to a list, and then researchers like myself or other people examining aging related concerns or issues reach out to you to see if you want to participate in their study, and you can get your name removed from that list at absolutely any time. The Alzheimer's Society has, as you can see, or for some reason it's not showing up on my end, but their webpage has four different kind of blocks you can click on for studies. So there's studies looking for people who have dementia, studies looking for caregivers, studies looking for family members of people with dementia, and then studies that are like clinical trials for Alzheimer's and dementia. So you can kind of search on here on the research portal, a list of each kind of opportunity pops up as well. And then the last one I wanted to talk about was the Saskatchewan Center for Patient-Oriented Research. It's also called Skipper. They have a patient-oriented research approach here. So patient-oriented research is a relatively new approach to conducting research. It's kind of where clinical psych and clinical research in general is moving towards. It's important to note that in this context, when I say patients and when they say patients, they're not meaning people who necessarily are in hospital or have like a health condition. What they're really referring to is people that have lived experience. So whether that's in caregiving, whether that's just being an older adult, or maybe it is living with a health condition, they want to take patient or persons with lived experiences and get your perspectives into what matters most in research. So you can go onto this website and you can participate in studies that are listed. Often they'll put on calls for advisory councils. So if you join an advisory council, that means you work alongside researchers to help determine what we should be researching, how we can be researching it, what questions are important to be asking, what kind of methods should we be using so we can actually reach the people that we're trying to study and help. The overall goal is to make research more meaningful, relevant, and kind of grounded in actual real world experiences because we know people with lived experiences are the real experts of what's going on. And as researchers, we really value those voices. And so this is a meaningful way to get involved. Then I just wanted to provide a kind of brief list for other resources just for kind of supports here. So the Canadian Centre for Caregiving Excellence, Alzheimer's Society of Saskatchewan, and Canadian Mental Health Association can all be really valuable just for finding additional support as caregivers. And that's everything from me. Thank you. Thanks for taking the time to listen. And stop.
All right.
See people? There we go.
Thank you so much, Kelsey, for just sharing your knowledge and for all the meaningful work that you're doing to support caregivers and older adults. It's really encouraging to see that research is now being focused on caregivers, and especially when you were talking about the preliminary studies and even just on the feasibility, that is just sounding quite encouraging and quite positive. So we just really appreciate just the knowledge that you have been able to share with us. And I really hope that there are caregivers on watching this that would be perhaps interested in sharing their lived experience because that can be just so impactful and powerful. And again, I just want to thank everybody here today for your time and your openness, just being part of this conversation. These cafes are really about creating a space for connection. And, even if we're doing it virtually, I think we're accomplishing that. So, now, before we wrap up, I just want to take a minute here to open the floor and see if there are any questions for Kelsey or anything that you'd like her to expand on. So, if that's the case, please feel free to either comment in the chat, and I believe Kate is monitoring that. And otherwise, you can unmute yourself and ask your question.
Could the
Sorry, was there somebody?
yes, could the information for Jill's or Kelsey's contact be displayed again with that code? I'm not really tech savvy and I didn't catch that slide.
Yes, absolutely. I'm also wondering if we can also send, like, I could send these slides to you guys and have them sent out as well here. I will share it though again.
Okay. Oh, now I gotta get it bigger.
Yeah, and we do have a list of the participants, so that is possible. We can absolutely email these slides out to you.
I'd appreciate it.
Yeah. And any other questions? Okay. Well, I think that kind of wraps up the day. But before we go here, I also want to invite everyone to our next Caregiver Cafe. The topic will be on advanced care planning. So another great topic for caregivers. And we'll be joined by Lauren Noble Lang. She's a senior health educator with the Saskatchewan Health Authority Advanced Care Planning Program. And this next session will be taking place on Tuesday, May 26, 2006 at 1:30 p.m. to 3 p.m. And it will be at the Saskatoon Fieldhouse in Meeting Room 3. So kind of our typical location. And you can sign up by either calling our office or you can sign up by visiting our website at scoa.ca.
And
So
I'll
with
just,
that,
sorry, Jen, I'll just add in there that if anyone has any interest in participating, and maybe that comes up a week or two from now, or maybe you meet someone who is interested in participating, you can always reach out to us in the Caregiver Center, and we will happily connect you with anything that you've seen here today.